Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and all I perform is aesthetic or cosmetic surgery. One of the common questions I have with regards to liposuction or body contouring surgery is, how long is the bruising and swelling going to last? And people ask me that before surgery. They'll ask me again a few days after surgery. They'll ask me again a week later, and people tend to forget the answer. I think it's because inherently we're excited and we're impatient. We want to see the final result. Depending upon what kind of liposuction I perform, actually will kind of give me an idea about how much bruising and swelling you can expect. The sophisticated liposuction techniques that we use now, basal liposuction, which is ultrasonic liposuction that helps contract the tissues and is much less traumatic than previous liposuctions, it's very uncommon for me to see a lot of bruising after that surgery. Swelling is a natural consequence after liposuction, and you can really expect to start to see what I've done. Although I see it in the operating room, you can expect to see some swelling for the first week or two, but that really starts to go down by about the third week or so. I think by a month or so, you'll really start to see the results, and by about 3 months, I think you'll see about 80–85% of what I perform. And I think people really start to get excited. They start to see that evolution of shape, and I think it becomes a quite reinforcing procedure for people, because I think they can't believe the new shape that they have. I think it's very empowering. Another type of liposuction I perform is basal high-def liposuction, which is an even more sophisticated technique, a body contouring technique, that is actually creates a bit more swelling and delayed swelling over time. In those patients, for the first week or so, we like to have them get lymphatic drainage, and we also like to have them wear a specialized garment that is even more constricting than the normal liposuction garment. In those patients, once again, you'll see most of what I've done in about 3 months, but I think the final result for those patients really takes a full year. Why? Because there's delayed swelling in the superficial layers of the fat that I perform the surgery on, and that tends to take longer to see the final result. Once again, even in those patients with basal high-def liposuction, bruising is pretty uncommon. So overall, I think that if we discuss medications to avoid before surgery, I think we want to go through a whole list and avoid any ibuprofen, aspirin, a lot of the herbal supplements now, fish oil. I think we can really minimize the bruising that you see afterwards. And I think by following a regimen of wearing your garment and following a protocol that we prescribe after surgery, I think that we can minimize that swelling and get you to that final point much quicker. Thanks a lot.